And welcome back. Well, the dreaded cold and flu season is almost here, and Dr. Mia Finkelston joins us now with preventable measures to avoid getting sick and how to tell whether you're too sick to go to work or to school. You can't fake it, you gotta know. Good morning to you, Mia.
Good morning. Thanks for having me.
Absolutely. We got some sick people around us. My co-host is sick. Everybody's sick. I'm trying to stay away. And a lot of people right now, they're seeing that sickness start. They want to make sure that they're preventing it for themselves. So are there some preventative measures we can take to sort of arm ourselves against the flu and the cold this season?
Definitely. You know, in the fall, you want to think flu prevention. So if you have not yet received your flu shot, no time like the present. Late October, early November is a wonderful time to do that because it will protect you during January, February, which tend to be the peak flu months. I also recommend putting your best foot forward by preparing your body, and that means, you know, be getting regular sleep if you can, and eat a nutrient-dense diet and get exercise most days of the week if possible. And also be prepared with a medical toolkit when you're well. You know, have that at the ready so that if you are sick, you don't have to, you know, shrug off to the pharmacy to, you know, stock yourself up then with saline sprays and decongestants and cold remedies. Have it ready at your fingertips when you need it.
That's a great idea. More often than not, you're running to the store when you're not feeling well or sending someone for you. How about the flu? What symptoms should we look for?
True.
Because as you said, this is the time of year it's starting, and I think it can be a little confusing what's what.
Yeah, and I think the biggest differentiator is that sudden onset. People with the flu tend to get sick very quickly, and it usually hits them hard with high fevers and then headache and significant joint and muscle aches that make them so tired they really don't want to get up. They'd prefer to lie on the sofa or stay in bed. And you know, you can also get some cold symptoms with it, you know, a little congestion, sneezing, but mostly it's really that high fever and the aches, whereas allergies won't give you the fever, but you'll recognize a pattern, maybe that scratchy throat and itchy, watery eyes. And the cold, though you can get a fever with that, it tends to not be as high, and you have that slowly developing cold symptom of the scratchy throat before congestion, and then the cough develops. So really the fever and the aches are the differentiator there.
I think the hardest thing is to determine when you're too sick to go around to other people, because you don't want to spread it, and sometimes you don't want to take time off of work or school. So when do we know it's time to stay away?
Whenever you have a fever, you are considered contagious. So that's always a good rule of thumb. And with the flu, you're going to feel lousy. So between the fever and feeling so lousy, stay home. Have your kids stay home until that fever breaks. In addition, if you're really have symptoms of that runny nose or a loose cough, even watery eyes, those are symptoms that are hard to control, even with best efforts of hand washing and keeping your hands off your face. So stay home till you dry up a little bit and until your behaviors are back to normal.
Hard to do, but we've got to give ourselves that permission, right? Are there any tools to help us just stay healthier this season?
Yeah, definitely. Video-based doctor solutions, are a wonderful way to connect with a doctor just like myself when you need it at the convenience of your own home or when you're on travel. And through LiveHealth Online, consumers can use their smartphone, a tablet, or a computer with a webcam and can connect when they need it with a US-based board-certified physician. And we can discuss any sort of non-emergency common cold symptoms, flu symptoms, skin rashes, pink eye, you name it. We are available 365 days of the year, 24/7, including holidays. And the doctors that you see can come up with a diagnosis, go over a treatment plan with you, and if a prescription is necessary, send that electronically to a pharmacy that you've selected before you've connected. We also have Cuidadomedica, which is our Spanish-speaking platform and allows consumers to select a Spanish-speaking provider to help them out.
We're out of time, doctor, but the cost real quick, is it expensive?
Well, in Wisconsin, with Anthem Blue Cross Blue Shield and its sister plans, it's a covered benefit. So go to livehealthonline.com for more information.
Will do. Thanks so much for joining us.
Thank you for having me.
Absolutely.
Bye-bye.
That website again is livehealthonline.com.